I hope everybody joins in early so that we can start a session as early as possible. Let us have one case. If everybody joins in, let us have one case. So let us have one case before we start the question answer session. I hope in YouTube everybody is able to hear what I'm saying. I hope the voice is okay. And Instagram too. So again, one more case to discuss. A very interesting case I had, hello Dr. Babel. A very interesting case I had where the patient was actually suffering from a lot of other problems, but the typical symptom I found in the patient was he could smell everything. He could smell a particular smell of the food, he could smell the particular smell of a perfume, of the room, everything, especially when he had coryza. So in coryza, very surprising, when normally there is a loss of smell, you cannot smell properly because there is a lot of coryza. This patient has had a very acute smell and he could smell a lot of things which he could not smell when he did not have coryza or normal person cannot smell of. And that is what I found the most important syphilitic symptom in that case. I hope in Instagram people are seeing properly. I hope Instagram. I think we started late on Instagram for about 2 minutes. So I'll recap the case again. Interesting case where the patient had a very acute smell, especially during coryza. He had a lot of complaint of spondylitis, of migraine. He had a lot of urine problem, recurrent UTI. And this symptom which I took for prescription, that in coryza, the patient, Dr. Sharon, welcome, Dr. Babel, welcome. And which remedy did I prescribe to the patient? A very, very, though rare, but it is infrequently used. Can anybody guess? I gave the patient a single dose of Kalmia latifolia 1M potency. The remedy is Kalmia latifolia. No, Kalmia latifolia. Remember, a very, very important remedy, a very, very infrequently used symptom, but acuteness of smell. When you can smell more than normal, when you can smell more than other persons, so it becomes a syphilitic case. So when it becomes a syphilitic case, the remedy becomes Kalmia latifolia, a wonderful remedy. Don't always think Kalmia latifolia only for heart complaints. Don't always think Kalmia. Good afternoon, Dr. Mishra ji. Don't always think about Kalmia latifolia for heart complaints and that deltoid rheumatism of right side. Kalmia latifolia has also other complaints, which basically are the symptoms, you see, which are very, very important. A very important symptom of Kalmia latifolia that I always want the doctors and students to remember is the patient is sleepless, wakes very early in the morning. मतलब पेशेंट बोलता है मेरे को नींद तो बहुत लेट आती है लेकिन मेरी नींद जल्दी खुल जाती है. Though he is sleepless, he wakes up early in the morning. This is a very, very important symptom of Kalmia latifolia. And one symptom in relation to joints, which is common to many polycrest remedies like bryonia is there, phosphorus is there, lot of remedies, but joints red, hot, painful. Remember, when the joints are red, hot and painful, think about Kalmia latifolia. These are the very, very important 3-4 symptoms which I have seen in my practice. One symptom you must know about Kalmia latifolia is leukorrhea follows the menses. Patient says, I just finished menses and the leukorrhea starts, and that's again a very, very important symptom of Kalmia latifolia. So leukorrhea symptoms, of course, the symptoms of heart, deltoid, but the joints are red, hot and painful and the patient smells better during coryza, do think about Kalmia latifolia. Now, can anybody tell me what are the other remedies where the remedies you should think about when there is acuteness of smell? You will get a lot of cases of renal failure where the patient will have this type of symptom, that is acuteness of smell. He smells everything very, very, the gravity of smell is too much. He smells a smell of maybe eating too much, smell of spices too much, more than normal, which he had. In lot of cases of renal failure, you will see, So this is again very, very important in our practice to understand the syphilitic part of the symptom which we have to prescribe. So acuteness of smell, there are about 4 or 5 remedies which basically you have to understand. And that is, first you should, which remedy anybody can guess? Yeah, welcome Dr. Parik, Dr. Umar, Dr. Mishra. I would. So which remedy do you find where you have acuteness of smell? Benzoic acid. बेंजोइक एसिड से ज़्यादा इंपॉर्टेंट भी बहुत 2-3 दवाइयाँ जो बहुत इंपॉर्टेंट है, या गुड आफ्टरनून डॉक्टर ईशा, बेंजोइक एसिड के अलावा भी कुछ दवाइयाँ बहुत बहुत इंपॉर्टेंट है डॉक्टर मिश्रा। इसके लिए अपना स्मेल के लिए आपको याद रखना बहुत ज़रूरी है। एक मैं आपको बताता हूँ, हमेशा याद रखना, कॉफिया क्रूडा। सेकेंड रेमेडी फॉस्फरस, थर्ड रेमेडी नक्सोमिका, फोर्थ इज लाइकोपोडियम, फिफ्थ इज इग्निशिया एंड द सिक्स्थ इज चाइना. These 6-7 remedies are very very important, and that you should remember and differentiate the acuteness of the smell which these remedies suffer from. For example, I'll try to differentiate. Phosphorus has acuteness of smell during headache. Write down the symptom in your Matermedica. Write down the symptom in your notes. That whenever the case of migraine comes, headache comes, vascular headache comes, cluster headache comes, the patient says, मेरे को बहुत ज़्यादा गंदी बास आ रही है, बहुत ज़्यादा बास आ रही है. During headache, there is acuteness of smell, and that the remedy is phosphorus. You would differentiate again Nux-vomica. Before menses, if there is acuteness of smell, strong smell, think about Nux-vomica. So in this way, doctors, you have to differentiate that symptom, so that, and you have to understand that you have to have at least 3-4 remedies for that syphilitic symptom, so that you can differentiate and you have a scope of basically giving the remedy. If you know only one remedy, then you have no option. So these are the final differentiation that you should make in the remedy. Calmia latifolia, I told you, phosphorus, I told you, Nux-vomica, I told you. Go home and see these type of complaints, these type of symptoms, and you'll be a better prescriber. Make sure. Okay. So welcome, Wound Healer. Welcome. I am watching. I don't know who's there, but welcome, Dr. Sayyed. So these are the very very important. This is a very important case which I had, and one case I will just extend to this, that whenever the patient complains, whenever the patient complains, जब patient complain करता है कि मुझे ऐसी बास आ रही है कि ऐसी, आपने भी सुना होगा कि patient says that I smell as if there is lot of mucus and lot of dirty catarrh in my nose. The patient has a bad smell of his own, as his own catarrh, as his own coryza, as his own cough. And that if the patient tells you symptom, there are 3-4 remedies again. 3 remedies very very important you should think about, And the first remedy, of course, if I tell you one symptom, the patient basically stinks so much that he has aversion to his own smell, his own odor. Which remedy I'm talking about? Anybody? Patient has disgust to his own odor. Which remedy? Anybody? No. I'm not differentiating fish smell, because हम तो क्या करते हैं कि मिश्रा जी, बहुत बार एमएम मटेरियल में लिखा हुआ है कि फिश स्मेल है और कैबेज की स्मेल है, ऐसे बहुत सारी स्मेल्स है, बट ये डिफ्रेंशिएट करना बहुत मुश्किल है पेशेंट के इसमें, तो इसलिए हम सिर्फ लेंगे जो हमको बहुत इजी मिल जाए. नाउ पेशेंट डिस्गस्ट टू हिज ओन स्मेल्स, यस डॉक्टर बाबल, वेरी नाइस, इट्स सल्फर. And so it is very important to know that when the patient has odor of like catarrh, like old catarrh, you must think first about sulfur. But second remedy that I found very useful in my practice, please write down in your notes, and that is graphitis. Graphitis again is a fantastic remedy when the patient has odor of old catarrhs like. And the third remedy you should think about is pulsatilla. In my practice, I have seen that differentiating odors, if you can differentiate, well and nice. If you cannot differentiate, just take offensive odor or fetid odor, then try to differentiate remedy. For example, if you say fetid odor, then you have remedies like phosphorus or parascotrifolia, Calibacrum, sulfur and belladonna. Calibacrum is a remedy which basically you should remember in cases of catarrh, because it covers lot of remedies of sinusitis and catarrh, and you'll be able to cure more number of cases if you understand Kali Bikram. Kali Bikram is a fantastic remedy. Go home and read that remedy. That is very, very important, because in nowadays there will be a lot of cases where the mucus is sticky and the patient is not able to take out the mucus, and Kali Bikram becomes a very, very important remedy. I have cured so many cases of old catarrh. So easy symptom, that is sticky discharge. The discharge is so sticky. One patient said that in the night my discharge was so sticky of the child that he had to go to the doctor in the night, and the doctor just gave him some pneumalization, and in morning patient came to me. One dose of single Kali Bikram cured the case. So it is not always that how many symptoms you take, it is which symptom you take. So it is always not the quantitative analysis which is important, it is the qualitative analysis that is important. Okay, so I hope you understood something about this case. These two cases just had in my OPD, so I wanted to discuss those cases. Salvar is absolutely right. Ambrogracia has few other symptoms which we'll discuss. Now, if you know Kali, you can start asking questions, okay? I think if you have questions, you start asking, because others will keep on talking about matter. So I hope there are some questions which is scrolled up. You can write down the question again. I was just telling you something about Kali Bikram, Now don't remember to only, again, Kali Bikram only for that, nasal discharge which is sticky and it hangs in long threads. It has lot of other complaints where you have to think about Kali Bikram. And you must think about Kali Bikram. Is there any post-pneumonia? Post-pneumonia, I had a YouTube reel, or I think Instagram reel, where I told that the patient suffered from sleeplessness after influenza. Which is that remedy? Anybody? I had lot of thank you message, because there were so many cases of insomnia after COVID, and that remedy worked very well. Which is the remedy when the patient suffers from sleeplessness after influenza? Anybody? I just put that reel about 1 or 2 days back. I think YouTube or a reel. I don't know exactly. Which is that remedy I'm talking about? Do keep reading my reels and YouTube as a day short, or in Facebook, because I keep posting those only cases, those only symptoms which I have seen in my practice. It is not theoretical, it's all clinical. So please go and see those. मिश्रा जी आप भी एक बार देखना, वो आपको इसका आंसर मिल जाएगा उसके अंदर. So what I was telling about, something about the symptoms of Kali Bikram in relation to stomach. A Kali Bikram patient, he will describe the stomach so beautifully. He says, my stomach machine has stopped working. I had a beautiful case. बोलते डॉक्टर साहब मेरा मशीन काम करना बंद कर दिया, कुछ काम ही नहीं करता, जाम है पूरा. These were the wordings of the patient. Which remedy comes to your mind? The patient says, this machine, stomach machine, has stopped working. Please give me something. Can anybody say which remedy comes to your mind? Yes, anybody? If you know the answer, you can write yes. If you don't know, you write no, that so that I can go fast. We have only half an hour. Avena Sativa was yes. So Avena Sativa when there is sleeplessness post-influenza. Very nice. But your name is a very bit scary. Devil's Create, So we wanted a remedy where the patient says that my digestion, my stomach has stopped working. And I had prescribed that patient, but I had failed in about 3-4 remedies. But as I keep reading Matter Medica every day, I got this symptom of Kali Bikram. Good afternoon, Dr. Namjot. Feeling as if digestion had stopped. And whenever you have this symptom, that is feeling as if digestion has stopped, and the patient will tell you at verbatim, think about Kali Bikram. Very, very important symptom of Kali Bikram. I have confirmed this in many cases in my practice. One symptom more of Kali Bikram that you should remember is, it's a Kali Bikram. Write down in your Matter Medica, Dr. Disha. It is Kali Bikram. The patient के wording ऐसे रहेंगे कि डॉक्टर साहब ये मेरी मशीन जाम हो गई है, ये काम करना बंद कर दी. and that how to convert that into rubric form or symptom form, that is the art. So we have a question, I'll take that question. Frequent mouth aphtase after taking alfalfa malt and alfalfa mother tincture. See, whenever the patient complains about aphthay after taking mother tincture, remember that is because either the quality of a drug is not proper, and second, it is because of the alcohol content, alcohol content in that mother tincture, which is hurting the patient. Just stop prescribing, just stop withdraw alfalfa, wait for 6 to 7 days. If it does not go, then you can think of some remedies. And the remedy should come on depending on how the ulcers are. For example, it is burning, redness, it is black, it is easily bleeding, and then you can prescribe the remedy. It happens in many cases where because of the alcohol content of the mother tincture, it hurts and it causes aphthase, ulcerations, and reddish type of eruptions in the mouth, or ऐसे बोलते हैं ना मुंह आ जाता है stomatitis type. This happens in cases. So you can withdraw the remedy, mother tincture, and wait and watch, and then prescribe on the quality and the character of ulcer. Instagram. Today Instagram is a bit slow. There are only few questions on Instagram. In YouTube, yeah, we are ready for some questions more. Yes, Doctor. I think Dr. Babel sulfur is right. The patient has disgust of his own body odor. You must have seen one of my reels which I put that the patient desires familiar surroundings. No, I only give that one symptom, but that describes the whole case. And because I have got results, I have put that symptom. Okay. Rhododendron, any good in Parkinson? Yeah, as I have told you, doctor, basically in Parkinson's, my approach basically is a complete case taking, because it is a degenerative disorder, syphilitic disorder. So basically, I will go with the constitutional symptom. So rhododendron, basically, I have not prescribed for Parkinson's. So just telling you symptoms theoretically of rhododendron, it would be very easy for me. But if you ask my experience, I have not prescribed basically for Parkinson. But whatever I have understood about Parkinson's, whatever cases I am treating in Parkinson's, I have seen that the constitutional remedy basically works very well. I have not cured any case, but they are doing very well with minimum requirement of allopathy medicines. Okay. Next. Of course, rhododendron, then basically there are other symptoms of rhododendron, means whenever there is, okay, DD of AJ in O2 lakh. Okay, Azadirachta coriander. Yeah, I'll take that separately, Dr. Babal, in the other live. You had asked this question. I had written some points, so I've just come today, so I'll basically give you that. But in a broad sense, if I want to answer Azadirachta indica, Azadirachta indica, basically, if you want to prescribe, one thing is very, very important. The patient should have, I've seen in the patient has recurrent history of viral infection, and that's why it's a process where because of recurrent history, the patient suffers from this oxygen problem, then you can prescribe Azadirachta indica. Coriander, basically, I prescribe in cases where it is an acute complaints, and in acute complaints, especially related to chest, and the symptom is that he gets a sudden dyspnea because of 2 or 3 viral infection, and then coriander works very well. In case of ichneusia, I have seen very, very important case of ichneusia. Ichneusia basically has secondary, secondary lack of oxygen. That means any primary disease which causes dyspnea and low saturation oxygen, then ichneusia I used. And osivamsan basically I use in cases of old age or middle age patient suffering from chronic COD or suffering from chronic asthma cases, chronic bronchitis cases for years, and because of that they develop this problem. So osimum I use, that gives a good result. So this is the basic differentiation in relation to these 4 remedies. Dr. Hita Belwari, welcome, join. Welcome. Hello and salam. Just got your Kali symptom. Nice. A quick question. Son woke up with ear blocked, sudden, and hearing affected. Yes, You can think about Kalimur. It's also very has the same symptom, But normally, whenever a patient comes to me and first he says that sudden manifestation. So basically, I go generalized with sudden manifestation, and sudden manifestations. And if you see sudden manifestations, there are in generalities also it is there, and what you call in here is also there. So when you try to repetize these, there are 3 or 4 remedies which are very very useful. You must think about. First is Maccar, second is Plumbum metallicum, and third is nitric acid. Whatever repetition I could do in my mind right now, these 3 remedies come to my mind: Maccar, Plumbum, nitric acid, and of course don't forget 2 remedies which are very very important for any kind of sudden complaints: phosphorus and belladonna. Dr. Ankush Malikar, welcome. Patient, sir, how much percent improvement you have got? Yeah, in Parkinson's, I have cases where they are much better. The allopathic medicines have been tapered, but they are still on with allopathic medicines. They are still not stopped, but the quality of life is good, and the patient is doing very well. But we have not stopped all the allopathic medicines. Patient 70 years has shrunken kidneys, has edema in extremities and abdomen, frequent maturation, no burning, insecure rectum. Patient is refused dialysis due to age. Apis failed. Yeah, I like your symptom, Dr. Mende. Insecure rectum, a fantastic word, insecure rectum. That means there are involuntary stools. Apis, don't always think about apis, when you have problems of kidney and this, what you call, kidney disorders, when the swelling is there, because these symptoms are very very common. These are symptoms are very very common. So if you prescribe an apis, then you have to have some symptoms of it, the pain of apis, the swelling of apis. So yeah, welcome Dr. Palak. In this case, of course, if you ask me again, I'll tell you the same thing. Take a case, because it's a case of CKD. Now you have to first see whether what is syphilitic in that case. Involuntary stools would be a syphilitic symptom. That's one. And second, if you see in your what you have written is that insecurity, and the patient has refused dialysis, and there is edema. So you may think about 3-4 remedies which are very very common, and you should think about that the first you should think about is phosphorus, second is sulfur, third is veratrum, and fourth is argentum nitricum, as I always prescribe constitution. But there are some remedies that I always say you must give ill serum. Ill serum is basically a diuretic which I have seen. It works wonderfully. Ill serum, solidago, thalaspi. But ill serum works fantastically, and in case of CKD patient or sunken kidney patient, we require repetition. So ill serum in LM potency would give you very good results and give you breathing time, because when the patient starts urinating, you get some breathing time, because the patient is calm, composed, and then give a better case, and then you can proceed further in this type of cases. Microalbuminuria and edema of extremities. See, whenever you are complaining about edema of extremities, so what happens? Edema means how is the edema? That is the answer. If you know exactly how is the edema, then you will be able to perceive it better. Now, how is the edema is one question. How do you see edema? Edema, basically, you have to then differentiate whether it is dark red, it is painful, it is very tensed, it is very shining, it comes during exertion. So to differentiate that also. But as you say that the patient has edema in the extremities and microalbuminuria, 3 or 4 remedies that you should think about, But okay, I'll tell you. So 3 or 4 remedies that you should think about in these type of cases where you have a problem of microalbuminuria. See whether the patient is suffering from a primary disease like diabetes, which also causes microalbuminuria. Now, in this case, I will tell you first remedy which are very very rare. First, you should think about terebinthina. Terebinthina is a fantastic remedy. Terebinthina is good. Uva ursi is there. Of course, cantharis is definitely there. Then you come to the chronic remedies like Apis mellifica, arsenic album, China, and one remedy is there, and that is medoranam. When normally when the swelling is very hard, think about China, graphitis, Maccarp, and Rustox. And sometimes the swelling is very inflammatory. That's why you can see la. Then Rustox, Cilicia, Pulsatilla, and iodum is there. So describe those type of complaints also. Yeah, Dr. Sarika. welcome. Actually, just asked him. He said it has been there for some time, and he had been taking wax out of it, but we he noticed hearing getting worse and a bit of painful coming there. I think just go for that test. Otherwise it may the patient might have an optic nerve damage. But whatever case I have seen in this case, so if it's a subacute case or a chronic case, then I think you should think about phosphorus, depending on the phosphorus child or the belladonna child, as we see in our OPD. Please tell ill serum in LM potency and repetition. Yeah. So normally I have cases where the creatine level basically 6, 7, sometimes 14, 15 also. So depending on the case, I start ill serum 0, 1 basically twice a day or 3 times a day. Then as the result comes, then I taper it off twice, once, then alternate days depending on the case. But yes, definitely when I start 0, 1, at least I repeat twice a day. Because normally I get those type of cases, where the creatine count is 10, creatine count is 11, and then at least it is important to give at least first some relief to the patient. So if the patient starts getting good urination, automatically the patient's fates develop. So then you can always curtail the relation, the what you call the dose. So one thing is there, snoring. Now snoring, of course, don't. It's not a specific remedy. But snoring, it is said that whenever you are prescribing remedies for snoring, make sure that the patient does not have sleep apnea. Because when the patient has sleep apnea, that when you breathe in, all the mouth and the tongue becomes dry. The patient has to get up, drink water, again the snoring starts. So if it is because of sleep apnea, it is altogether different ball game. Simple snoring. I had a case where the patient says that snoring started of my child when I remove the adenoids. So simple snoring after removal adenoids, you can think about Kali Salve. Or sometimes the patient comes and tells me that I have a lot of fear of exams, I have a lot of this, and the parent comes, whenever there's exam, whenever there is fear, I see my child snoring very much. And then you have to think about remedy called as Sambucus nigra. So these are how you have to differentiate in snoring, snoring on inspiration, expiration. But few remedies of snoring that you should remember, that is, first is opium, Laccan, Hippozinaminium, Teucrium marum verum, Lemna minor, Agraphis nut, and Sanguinora nitricum. These are the remedies you should think about. Yeah, thank you. Any space of snoring. So these are the remedies which I normally think about snoring, and make sure that you basically prescribe a good remedy, because the problem of snoring basically is felt by the relative, the associates who sleep near the person, and not the person. He does not know what is happening. Yes. BOL on scalp after mental. Yeah, boils on scalp after mental exertion. I would say, remember one thing, if by mental exertion only boils are coming, that means the body is trying to drain out that soma of that mental stress through boils. There's no need to treat, it's a soric expression. So why do you want to treat? Let it come. The stress goes, the boils goes. So in this type of case, just give a dose of Phytum, and tell the patient to have proper hygiene and eat proper food, drink water, and I think the boils should go. If it is recurrent, chronic, then you should think about something. That's what I feel. But still, if you have still, then you must think about those. There are 3 or 4 polycrus that you should think about. Calcarea mure, if you have never used in those cases, think about Calcarea mure, think about Calcarea carb, think about sulfur, and think about a very, very interesting remedy, that is arsenic album and Kalicar. Medicines for head. My elder son again got dry cough, eating junk food, starting son like a drum, dhum, dhum. It's like no drum. Think about spongia, think about mephitis, and think about Drosser also. Your husband is better, thank you. Very nice, very nice. Good, Dr. Baba. Medicines for headache and eye pain, and also pain in the and also had pain in female patient. Yeah, medicine for eye pain. I told you, whenever there is headache and eye pain, think about Kalicarb, think about amyl nitrate, think about belladonna, think about jaborandian, think about Senega. Pain at the submandibular gland, right side, from cold weather, maybe tonsillitis. See, whenever basically you have written the answer in your question only, no? Normally, whenever there is winter, or normally what you have written? Cold weather. So, whenever if you have these cases, you basically have to sum up that we have to have a remedy where winter aggravates first. We have to have a remedy which is right-sided. Just ask the thermals and you will get easily the remedy, So we have a case in front of us that it's a cold aggravation and right side. Think about few remedies which that comes to my mind. If I repetize now, it's ammonium carb, it is bryonia, lycopodium, pulsatilla and rustox. Of course, calibacrom is there and silicia is also there. Ammonium carb is also right. Lycopodium, bryonia, pulsatilla, calibacrom, their remedies also there. Cold personalities, chilly patient. So you can add, see, this is how you have to take symptom. Now you have added one more symptom that the patient is chilly. Now we have three symptoms: cold aggravation, right side and chilly. So cold aggravation, right side chilly, let me repetize. Ammonium carb, rustox, causticum, belladonna, calibacrom, silicia. 6 remedies. So this is case taking. This is a fantastic way of asking questions so that you basically come close to a remedy. So you got the remedies: ammonium carb, rustox, belladonna, causticum, calibacrom, silicia. Good evening, sir. Dr. Srivastava, Dr. Komal. Okay, welcome. Its side nasal polyp. Baby does not seem distressed. You can think about phosphorus. Loud respiration in a baby 4 months from nose and chest. Had Sambucus help for a day or two only. See, if the remedy is acting for a day or two, don't just discard the remedy. Maybe increase the potency and see once, and then you can see something about those remedies. Don't discuss because it is at only for 2 days. Sometimes you need repetition, or sometimes you need a bit of high potency to cure that case. So increase the potency and see, and wait and watch for a week, and then get back to the patient. It's nasal polyp. Now I don't know what nasal polyp means. The patient has nasal polyp also. So if doctor, who's the doctor? Yeah, so we have one more symptom where the patient says that we have nasal polyp also, and winter aggravates we have what you call. Yeah, so again the remedies are very, very common, and which comes to my mind, and they're right-sided. That is very important, doctor. So very good case you have taken. Whatever I can repetize, write down. It is calibacrom, silicia, belladonna, causticum, and sanguinura nitricum also. 5 remedies. Do remember this. Who's the doctor? I don't know the name of that doctor. Devil's creative. At least change the name. It sounds very, scary. So calibacrom, silicia, belladonna, sanguinura nitricum also comes in the repetize. Winter aggravation, nasal polyp, right side, chilly. So we have 4 symptoms. A good case, repetize, and the remedy comes. Rosy. Okay, so rosy is a better word, It's a good word. So can the remedies be Merck idoflavus? Yeah, right-sided. You can think about that. Yes, you can think about that remedy also. But whatever symptoms you have told me, I'm just telling you. Merck ido is left side. Yeah, you can. Merck ido rubrum is left side, and Merck idoflavus is right side. Yours is left-sided is Merck ido rub. It's already 34 minutes. It's already 3:30. I think the time is over, and enjoyed talking to you. This is how the frequency of questions should be, so that I also have to just keep thinking and have to tell you the symptoms or remedies on this spot. So it keeps my mind racking also. So everybody, thank you for joining, and thank you for your time. Until we meet next time on Instagram and YouTube Live. Bye from me.